The primetime lineup is sponsored by Lennar Homes.
New Ask Dr. Phil. Telling the lies that you've been living. Signs to look for if you suspect your spouse is keeping secrets.
Today at 3 on WPTV News Channel 5.
Ask the Doctor is sponsored by Boca Raton Community Hospital.
You don't have to be a professional athlete to suffer serious shoulder injuries. Dr. Alan Saperstein of Boca Raton Community Hospital joins us this afternoon to answer your questions. And by the volume of questions, Dr. Saperstein, people are suffering from shoulder injuries. It's a serious thing, and I may just be getting older, but it seems like a lot of my friends are having surgeries or some type of therapy for shoulder problems. Is it my imagination or no?
No, I think it's not your imagination. People are sustaining shoulder injuries in a greater frequency these days, and I think there's two factors at work. One is the aging population, and the second is our further interest in remaining active, particularly into our older years.
So we're playing tennis and perfecting a golf swing as we get older.
Oh, absolutely. And the body really does wear out after a while. And as we continue to put that type of stress on our shoulders, the natural tissues, the tendons, the ligaments, the cartilage, they begin to wear out and people start their problems.
But this is not an injury that's limited to the older age group. This happens to younger athletes as well, doesn't it?
Oh, absolutely. The difference is in the younger athletes, it usually requires either more repetitive stress, more throwing at a higher level of participation, or it requires a trauma, a major sports injury from being hit, being tackled in football.
Anything that parents can do with a young athlete or should not allow a young athlete to do to prevent shoulder injuries?
Well, the most important thing is training tips, particularly a throwing athlete, a baseball player, Little League player. The pitches need to be counted. They need to make sure that they don't throw too frequently, too hard, and for too long. The main way that kids get into trouble is just doing too much. What about frozen shoulder? Well, frozen shoulder is not really an athletic injury. It's a condition. Usually we don't know why it occurs, but the shoulder starts to tighten up. It starts to freeze up and loses motion. It can be very painful.
How do you treat them?
Well, most of the treatment is just watching it because it does get better on its own 95% of the time. But we can enhance it getting better with injections in the shoulder and with physical therapy.
Another viewer called and said that the person lifts weights and sometimes after getting home from being at the gym, just trying to take a shirt off, there's a shoulder, you can't, the shoulder hurts. Now, I'm not exactly sure what that is, but then, and it hurts for a few days and then it goes away. The person wants to know, should I have my shoulder checked, or is this just something that occurs and I just live with it for a few days?
Well, it should be checked. Not any pain that is sustained, anything that lasts more than a day or two and keeps recurring every time you work out is potentially a problem. It could be many things. Could be the rotator cuff, could be the acromioclavicular joint, could be the main shoulder joint itself, and it's hard to tell what it is just from hearing the story, but it needs to be checked.
And very quickly, we had lots of questions about rotator cuff surgery and if it's getting a lot better and if it's easier to recover from than it used to be.
Oh, absolutely. I don't think anywhere in orthopedics have we seen such a revolution in technology as we have in shoulder surgery. 10, 15 years ago, our shoulder surgeries were done open through fairly large incisions. Now we do almost all of our shoulder reconstruction through arthroscopic, minimally invasive techniques. We just make tiny little holes around the shoulder, look inside with a camera, and we can fix things using a cornucopia of instruments that are able to repair and clean tissue.
So there's hope to have a great golf swing or a killer serve after rotator cuff surgery.
Absolutely.
Oh, that's great. Thank you, Dr. Saperstein, for your time today. Boca Raton Community Hospital sponsors our expert for our segment for Ask the Doctor and is also the sponsor of Ask the Doctor. We're back with more in just a moment.
When it's cancer, your focus should be on getting better, not getting referrals or finding physician offices. At Lynn Cancer Institute, multimodality care brings the team to you. With the world's most advanced imaging and leading-edge treatments, we're dedicated to your cure from day one. It's why we're among the top 5 cancer programs in Florida. Exceptional cancer care. Lynn Cancer Institute at Boca Raton Community Hospital.